LafargeHolcim. I'm John Mahalik, Tech Service Engineer from our North Central region. Thanks for joining us today in our discussion regarding our company's internal management of COVID-19. Today we have three members of our human resources team, and Kalia Swam, Jamie Arndt, and Steve Smirchna. They've been critical in helping us manage through this process and have worked on a number of things that we hope will be relevant to all of you. So with that said, Jamie, I know you had been working on a few specific topics. Do you mind sharing some of the things that you've been working on?
Sure. Thanks, John. So if we think back to March when all of this started, we did a couple of things right off the bat. First, we established a cross-functional team focused solely on all of the COVID needs, and we filled it with maybe eight members of cross-functional people. So somebody from HR, somebody from benefits, from our legal team, from the operations side, so that when the issues came up, we had a group that could look at it from all different points of view. And then we quickly established what we would call a quarantine policy, so that our employees would know not to come into work if they had symptoms, and to call their manager or to contact HR, and how and when they would be paid under any sort of quarantine situation. I think as time has gone by, and this has lasted perhaps longer than we thought it might in the very beginning, we've done quite a bit of work to prepare our offices to start to return office employees back. So we've done things like put in plexiglass, of course the mask, wearing face cloth coverings, and the higher walls across the cubes, and space our employees out. Just make sure that it's very, very clear that when you're in the office what the spacing requirements are. Because I think now that we know this is going to be with us for some time, we're trying to slowly phase office employees back into the office as well.
I appreciate that. Steve, I know you've worked on it. This has been a very challenging thing to try to address. Can you kind of talk through some of the things that you've been working on?
Yeah, as Jamie said, it's just time we started talking now about employees returning to offices, but both for those employees as well as those that work in operations who've been working this whole time. The key thing to have a safe workplace is to keep those employees out who might have the virus or might have been exposed. So one of the things we do is add a questionnaire that any employee or visitor to our property fills out before they come on site, indicating if they've been in touch with someone or close proximity to someone who has the virus or might have the virus, have symptoms, things of that nature. And that way we can take action and keep them out of our site if they're at risk like that.
Thank you. Flea, I know this has affected a lot of our employees emotionally and physically and financially, and maybe you could talk through some of the things that we're trying to do for people as some resources for people's families.
Sure. So from the beginning, we really wanted to make sure that we were re-emphasizing the critical need for people to look at their own health, whether that's from a physical or emotional well-being standpoint. So we have been communicating, sending information to our employees' homes so that it gets to the spouse and any children that are living in the home, really focusing on physical health. So the importance of exercise or daily activity, the importance of nutrition and how that impacts your well-being. We know that from the data that the CDC and all of the medical community has been sharing is that everyone's at risk for contracting COVID, but those with chronic comorbidities or health conditions such as diabetes, high blood pressure, if they contract COVID, they actually have a higher risk for more severe case than someone who doesn't have other chronic conditions. So although we know that a lot of doctors' offices were closed at the beginning of the pandemic, it's really important, and we're re-emphasizing this, that our employees and their families continue to follow the care of their physician and access care when needed. We also know that anxiety, depression, loneliness has also been a big issue during the pandemic and likely will continue to be prevalent as COVID stays around for a while. What our focus has been on our employee assistance program. So employees and their immediate family members can contact via phone 24/7 our EAP, or access the online EAP portal for virtual counseling, conversations with professionals to help them through this period of time. You know, at first we saw that people were very anxious, stressed out, not only because our routines changed, but how do you deal with this new environment that we're living with? Our whole livelihood changed. And now we're seeing people starting to get a little nervous, anxious about schools reopening for those folks who have children. So our EAP can be available to anyone at any time for any type of issue that an employee and their family is facing. And then we also spent some time and continue to spend time talking about financial well-being. Your health might be good. You might not have a lot of emotional issue or anxiety during this time, but we know that employees' families have also been impacted by perhaps reduced work hours, furloughs, and layoffs. So how can you continue to be mindful of cash? Perhaps talk to a financial counselor if you use the program to really focus on continuing your long-term savings for retirement, or even just your savings plan in general, especially if your income has been impacted in a negative way during this time. So our program really focuses on all three of those components from a well-being perspective, and we'll continue to help our employees and their families live their healthiest life by using the programs that we make available.
Thank you very much. Appreciate that. Jamie, any final closing thoughts for the customers out there that are watching this? Any practical advice or just high level things?
Just a thought on maybe some of the steps that we've taken when we've actually had someone tell us that they're positive for COVID. I think it's a kind of an important thing to cover. First we've tried to make sure that the employee who has it is getting the help that they need. And then we go through this exercise that we call contact tracing. So it's just kind of a checklist of who has the employee worked with, been close to, so that we can notify anybody that they may have come into contact with and determine if their contact was long enough that it may have passed from one employee to another, and then make sure that we are quarantining. And then once that occurs, we would deep clean any area that the employee had worked in, so that we could be prepared for employees to return back in. Just some of those steps if you're going to need it.
Yep, appreciate that. Steve, sure. Any thoughts from your point of view, closing thoughts that are relevant to our customers out there?
Yeah, probably two quick things, John. I mean, the first is communication, right? When you know things, or if you communicate things to your employees, you might make sure everyone gets them and that it's the same message everywhere. And secondly, over time, because of a lot of the state regulations and things that come out, you can have a sequence of communications. There's one this week, there's one next week, there's one the following week. Doing something that allows all those to be in one place for employees to access is a good thing, perhaps. Lastly, I'd say the COVID situation can impact everyone differently, as Falia referred to, when it's financial, emotional, and health. And so for every employee, it's a little different. And for supervisors and managers, a key thing is just to deal with each employee individually and be a little patient. Their behavior, their responses, how they work might just not be the same as it would be in a non-COVID time.
Yep. I appreciate that. Falia, any final thoughts from your point of view?
Yeah, I would encourage our customers to really take a look at what programs they have available for their employees and their families. You'd be surprised how much is already built into your benefit plans already through the vendors that you work with. So give your teams a call who work for those vendors and see if there's anything that you can communicate, promote, and really start trying to engage people to take a look at their own personal health and then work with those vendor partners to improve their health.
Thank you very much. Well, we hope this information was, there were some things in here that you could take away for your business out there. From all of us at LafargeHolcim, we remain optimistic about the future as we move through this. We wish the best to you and all your families.